Since the early morning, Yael Liron has been on duty on a COVID ward. An elderly patient needs oxygen and some comforting words. The COVID wards at this hospital in Tel Aviv are extremely busy.
There are a lot of cases. We have new intakes every day. When one is released, another is submitted at night. Numbers are on the rise. We always experience a delay. Even when the general infection rate seems lower, we at the hospital are still dealing with the higher numbers from the 2 weeks previously.
Though overall Omicron infection rates show signs of slowing down, the number of patients in hospital remains high. Israel was one of the first countries in the world to roll out a rapid vaccination program. Over 65% of the population have been vaccinated twice, but only 48% have had a third booster shot so far. In January, those in the most vulnerable categories were offered a fourth.
During this wave, most of our patients have been elderly. It reminds us of the flu. The complications are comparable. People are dying now the way they would die from the flu. Also, fewer people are dying of Omicron.
Most patients on this ward are vaccinated elderly people with underlying health conditions. Working on the ward is exhausting for everyone. Adding to this, hospitals, like other institutions, are struggling with staff shortages. Due to the highly contagious Omicron variant, high numbers of doctors and nurses are in quarantine.
It's difficult. It's the 5th time we've been at full capacity here in Israel, but we're dealing with it. That's just how it is, as they say, and it's our job to look after patients. But it's definitely hard, and there's a lot of burnout among the staff.
We have to work very hard, but we're happy to do what's necessary. But yes, it's exhausting, and it doesn't look like it's going to end soon. Although, I am personally cautiously optimistic.
For now, everybody here must keep going, doing the best they can for the ongoing influx of patients and hoping that the peak of the current wave will soon subside.